With the growing coronavirus pandemic, there's been a great divide in the reactions of many. Currently in Santa Cruz, indoor masking is still required regardless of vaccination status. These settings include public transportation, healthcare settings, congregate settings like correctional facilities and homeless shelters, long-term care facilities, K-12 schools, and child care settings. Using public transportation such as buses is also really common in the Santa Cruz area. With that being said, wearing masks on these vehicles is vital because of the overwhelming amount of those people in these vehicles. Bringing in the idea of the politics of COVID, specifically in the United States, there are various problems that arise. COVID-19 often gets politicized in ways where the two primary parties argued on the topics of masks and vaccinations. On the left side, many support the idea of masks, prioritizing public health above all. They believe in science, which will ultimately prevent the spread of COVID-19. On the right side, many support the idea of choice and freedom. Statements such as "my body, my choice" are often plastered on signs during rallies. There's one primary question that arises from this concept that I would like to address. If the two political parties cannot agree, how do they expect citizens to agree? The pandemic has shown how much of a divide our country continues to partake in. One of the largest problem areas with the coronavirus pandemic is the government's two political parties' disagreement as to how to handle the pandemic entirely. Instead of supporting the people, they are playing blame games, which entirely dismisses the main issue we are facing at hand. Essentially, politicians are prioritizing politics over the actual health of their citizens. Some believe it's a science, while others believe it's a hoax, until many realize that wearing a mask and being vaccinated goes beyond just protecting themselves. This problem in the U.S. will continue to occur.
Hello. On a broader note today, we're going to discuss some solutions. We will primarily be discussing improvements regarding both the political administration's attitude towards the pandemic, along with incentives to boost morale and responsibility amongst the public through the use of effective policy. First, let's start with the attitude. The transfer of power during this pandemic definitively politicized a lot of human rights issues. Under the Trump administration, there was a blatant disregard for science, starting with the rhetoric surrounding the pandemic. When there were global efforts to combat the pandemic, our nation was lagging. There was a stark contrast between those attitudes of both administrations regarding the science based on the pandemic. Leadership fuels a nation's ability to be responsible. The politicization of this pandemic was evidence of health being used as a weapon for political agendas, instead of it being a tool for good. According to the professor of English at the University of Michigan, Ann Curzan, the historical definition of the word rhetoric is the art of using language effectively in order to persuade others. Therefore, positive words regarding the pandemic and preventing misinformation could have easily made the public more serious about their actions, and it would have helped the public comply with the guidelines. If this had been the approach from the start, it's highly likely that there would have been significantly fewer deaths caused by this virus as a whole. Now, moving on to effective policy. There are several things our government could have done to improve the execution of policy with regards to this pandemic. One of them is transparency, in terms of what steps the administration was going to take to effectively approach such a complex issue. For example, there could have been a monetary incentive approach. The stalling of COVID-19 vaccination rates threaten public health. To increase vaccination rates, governments across the world are considering the use of monetary incentives. The outcome of this pre-registered randomized clinical trial conducted in Sweden was that monetary awards had the power to increase participation. So what was found in this study is that people were actually more likely to get vaccinated when there was to be ensured an award. Now, in a perfect world, people would be concerned for the health and well-being of others with no gain. But in a capitalistic society such as ours, that is nearly impossible. Financial incentive has generally increased the public demand for safety and self-awareness in regards to the pandemic. In a way, the government profits off of its own ambiguity. with politicians making claims about policy on the debate stage, but not actually having a specific plan to implement them and see it through. If the people were actually informed about their plans, then there would have been a lot more of a push towards science and accepting that science. Educating the public leads to accountability for the government, which is why the government prefers ambiguity. Now, with these two things in mind, these are just some solutions. Knowledge is power. Therefore, educating the public and creating monetary incentives can also help the public be responsible for themselves and others.
Hello everyone. Let's have a look what India had to face because of the politicization of COVID. Migrant crisis. It happened when the Prime Minister of India appears on the national television and announces nationwide lockdown. All the transportation activities, livelihood practices stopped. Many migrant laborers lost their jobs, had to move down from metropolitan cities to their hometowns while crossing down thousands of miles. While on the road, they had faced severe challenges, no food for them. They had to sleep on roads. The state were ignorant toward them. Police brutality was there. Government remained silent throughout this time. I had an opportunity to interview one of the migrant workers who walked 600 kilometers in around 20 days. His name was Mr. Ghanshamji. He said, "It is one of the worst times that I have seen my whole life. People were dying like animals. There was no food available for us. We were walking down thousands of miles from our home. Some people helped us, but not the government. They left us to die on the road." Another problem was shortage of oxygen and ventilator beds. A severe shortage of oxygen cylinders and ventilator beds. Social media was filled with the messages of help and availability for beds, but many people died because of it. They proposed the statement that there was no shortage of any sort of facilities in the state. The central government recently released a statement in which they stated that no one has died because of the lack of oxygen or bed availability. And to support this statement, they had this report of every state which mentioned that there was no death because of any lack of facility. Another challenge was black marketing of medicines. Many people bought medicines from black market because of the unavailability of them in the hospitals. It was the responsibility of the state to provide the proper medicinal care to their patients. But the Ministry of Food and Drug Safety did not regulate it properly and monitored the supply and demand of the medicines. And because of that, severe loss had to face by the citizens. They had to buy some medicines which were only costing $3, that is around 250 rupees. They had to buy it for more than 10,000 rupees, that is around 150 rupees. Some people bought 2 to 3 lakh rupees injections, which helped them to survive the COVID virus. That is around $2,700 to $4,000 for one injection. Main reason for the politicization of COVID was media. As we all have heard, the media is the fourth pillar of democracy. But in India, media is almost ruled and governed by the ruling party now. They did not even ask the Prime Minister and the administration about the steps that have taken by them. They did not even considered capturing the migrant crisis and shortage of oxygen and bed crisis. They only praises the Prime Minister whenever he comes and deliver his monologue on the national television. On the other hand, media has circulated various and numerous news of minority groups spreading the COVID virus and harming the religious sentiments of many people. Media is one of the major medium in India for dividing the people on the basis of their religious faith. Last but not the least, there were some bizarre comments by the politicians that we all have heard, but India is not exception to it.
As we have looked at some of the core problems that India faced during this period, we'll try to look at some of the solutions too. There was a huge mismanagement after the outbreak of the pandemic, and the entire situation got politicized very soon. A politicized media is capable of doing immense and irreparable damage to the nation. To deal with the situation of media in India, grassroots level of journalism is required. The idea is to engage with the local information to have a better understanding of democracy and politics. Community media are important in giving communities a platform to express their concerns about local issues, engaging in democratic debate, and delivering reliable access to the information. And we have seen that where there is a community centered approach, the communication among the state and its citizens develops, which result in fair decision and policy making with responsible efforts of implementing them. Another huge problem was the migration of people during the lockdown. While interviewing some of the members of the marginalized nomadic tribes of India, they made it very clear how different politicians from different political parties would come to them and blame the opposition for not fulfilling their basic needs. The people couldn't go to their houses, they couldn't get groceries, even they didn't even have any shelter. At this time, the Kerala state of India, which did a commendable job in handling the crisis overall, showed a great solution to this situation. They considered migrants as guest workers. They provided them with shelter, with food, and other basic necessities. For the long term, there should be registration of informal workers. They should be treated respectfully and equally, as the state is responsible for the welfare of its citizens and it should be held accountable for that. Regulating committees and strict laws to stop the black marketing of medicine is a necessity in India now. The Ministry of Food and Drug Safety must form a committee to have regular monitoring on the demand and supply of the medicines, both in private as well as public pharmaceuticals, so that it does not cause a heavy burden on the suppliers in cases such as pandemics and can lead to further black marketing. Lastly, every politician and citizen must be aware of the concept of good governance. The awareness of the citizen is the key. The idea where the state is accountable, transparent, responsive, inclusive, and participatory would be a way to achieve some sanity in this insane neoliberalism. While taking different measures or initiative, a bottom to top approach should be followed with participatory methods. Instead of blaming the oppositions, the main goal of the state should be welfare of its citizens and take efficient measures at the right times. But sadly, even after 2 years of the pandemic, the political parties are still playing the blame game by accusing the other parties for the COVID spread. We can't assume that we would achieve a utopian state, but we can surely work towards it. Someday, by walking on this path of good governance, we might achieve what we haven't imagined yet.
In regards to the issues and concerns presented in India, it is clear that several states are facing oxygen shortages. The demand for hospital beds, oxygen, and medicines soared when COVID cases arise. Negative reinforcement implemented in India clearly seemed to work, which I feel that the US could have used. At the same time, both countries heavily struggled with the pandemic. Just the way that they approached it was very different.
The goal should be of focusing on damage control rather than blaming opposing politicians. I feel as though that the state is inherently responsible for its citizens' welfare. But because there is no proper registration and political identity of migrant laborers, more specifically the migrant sector, they are mostly ignored. We need to take a page out of India's book and make vaccinations and COVID testing free for everyone, regardless of citizenship status, regardless of economic status. I feel as though we need to take more of an initiative that India has been taking, as Aditi has mentioned, that there are fines if you aren't compliant with the mask mandate in order to implement the bottom to top approach. That in order for anything to truly work, you need to understand the gravity and the seriousness of the problem, whether that be by means of research, whether that means by the use of effective rhetoric. It's essentially important for leaders to understand the gravity of the problem in order to attempt to implement effective policy to help combat that problem.
In our perspective, the USA and India have faced some similar crises during the COVID. The way government ignored homeless people and informal sector workers in India, it has also happened in the USA. The blame game of politicians for not accepting their inadequate governing and irresponsible actions happened in both the countries. People look upon the USA as a development model, but the systematic challenges are still there. The USA have better healthcare system, but the marginalized people deprived of it there as well. The idea of neoliberalism and privatization only results in the ineffectiveness of governance, and the consequences of it has to be borne by the citizens only.
So, this entire experience leaves us with some bigger and universal questions to ponder upon. For example, is the combination of neoliberalism and current political scenario going to be the downfall of free will and social equality? The hunger for political power all around the world suppressed the basic idea of common welfare. Does it need a pandemic and numerous deaths to realize the vulnerability of informal sector? And lastly, after going through such horrible crises, are the nations now prepared to tackle future disasters of the same intensity?